today we have with us Dr. Sanjib Kumar Das, Consultant and Associate Professor, Department of Kai Chikitsa, Sri College of Ayurvedic Science Research Hospital, Sri University, Cuttack, Odisha. A very good friend of mine and a very talented and dynamic personality with a lot of long list of achievements. So let me read some of it here now. More than 10 publications in national and international journals. He is very much interested in research work and always involved in what the other research. So he has researched as principal investigator on NaOQ10 for COVID-19 infection, which is approved by Ministry of Ayush. So it was a very great achievement of Ayurveda as an Ayurveda physician. Next, he researched as principal investigator on Cabasora coordinator for COVID-19 infection. During COVID-19, his work was really appreciable. Researched on Ayurveda management of acute hepatitis, researched on Ayurveda management of alcoholic liver disease, researched on Ayurveda management of SLE, researched on Ayurveda management of insomnia, researched on Ayurveda management of IBS. Still now, and he is still in got G Award and Fellowship by IPS 2022. Kumar, today's webinar is Ayurveda management of acute hepatitis. Practically, he has treated many patients of acute hepatitis, and today he will be sharing his experience and his practical work with all of us. And I will request all the participants to please be attentive and listen to him, because it will help you out and it will also motivate Sanjib Kumar Das to please listen. Hello, sir.
Thank you, Dr. Preeti, for giving so many big words on me. Actually, I'm not so big. I will be big. I'll be taking more time to be big. So today I'll be sharing my experiences in my Sri Ayurveda Hospital, Sri University, and because nowadays what our students are facing the problem of diagnosing the cases and treating it in an Ayurveda way. So that is a very lack in our system right now. So before starting my discussion, I'd like to thanks to the whole team, Dr. Shailendra Yadav, Chairman JS Group, Dr. Sunita Yadav, Director JS Group, Dr. Srinivas GK, Principal, Sri Babu Singh, Jai Singh Ayurvedic Medical College, Farukabad, UP, and I'll be very much thankful to Dr. Preeti, my friend, working as an associate professor in the Department of KC. Am I audible? Am I audible?
Yes, sir, you are audible, sir.
Yeah. And I'm also very much thankful to Dr. Nihar, my friend, my batchmate, working as an associate professor in the Department of EK. And also thanks to Dr. Srinivas BS, and thanks all the stakeholders of Sri Babu Singh Jai Singh Ayurved Medical College. And I am feeling fortunate enough to be as a speaker in front of all of you. So my thanks and also my love to my juniors and my respect towards my teachers, my senior faculties from across the nation who are actually watching my video. So today we'll be discussing a very good topic. So let me introduce, Dr. Preeti has already introduced. Let me introduce myself, Dr. Sanjib Kumar Das, working as an consultant in the Department of Kaya Chikitsa, Sri College of Ayurvedic Science and Research Hospital, Sri University, Odisha, Cuttack. So my experience means I have been practicing since 2012 and focusing on conceptual review on diseases from Ayurveda point of view and also treating the diseases what has been described in our classics. So I will be giving my knowledge, I will be sharing my knowledge. If anything, any doubt is coming during my discussion, please you just drop in the chat box, drop your message on the chat box. So I'm open to all. I'll be discussing after the completion of my presentation. So today the presentation will be on why I have chosen this topic, because you know that since COVID, so many medicines we have been prescribing to many patients, and in different regions, it has been established that Ayurvedic drugs are causing hepatitis and also many liver problems, liver issues. So since they from that time, I have been working hard on particular medicines which will to prove it false that no, Ayurveda medicines are very effective and without having any hazardous effect to cause any liver related issues. So that's why Jai Jagannath to all of you, to all the participants, all assistant professor, associate professors, HODs, principals across nations, everyone, IT people, my dear friends, my juniors, seniors, everyone. So Jai Jagannath to all of you. So let me discuss about my topic. So today's topic of presentation is, please madam, proceed to next slide. So today's topic of presentation is Ayurvedic management of acute hepatitis. Next slide, please, madam. So, next slide. So, my dear friends,
Yes, sir. 1 minute. Just
no problem, no problem,
network issue
no
is
problem.
there,
I'm
so
sharing
I'm
my
sharing.
experiences. My dear friends, you may be thinking that acute hepatitis is a very, sincere approach of the doctors to the liver. So, why Dr. Sanjib, being an Ayurveda physician, why he is approaching? Because you see uh, that many learned doctors are there, and although the students who have joined here, they may be knowing about the normal physiology and anatomy of the liver. And you know that liver is such a organ that whatever input we are taking, and that will be tolerated by the liver, and how much injury you will give to the liver, that is depending upon you, whether you are having a good diet, whether you are having incompatible diet, whether you are taking alcohol, whether you are taking any toxins to your body. So you know that all the things or all the toxins, everything in the diet form will reach liver, and if your liver is good, everything will be detoxified, so your body will be good. So whatever insult or whatever work you are doing to the liver, that should be within your limit or within your range, so that your liver can tolerate all the assaults given by you. That's why liver has been told as the very important gland of your, or very important part of your body. So you know about the anatomy of the liver. So now Dr. Pitu will approach towards the next part of it, management of acute hepatitis through Ayurveda. So next slide, please. Please, next slide.
Doctor, just 1 minute. Actually,
No,
some
no, no
network
problem.
issues is going.
You just let me know.
Just I
Yes.
am sharing from
Yeah,
another.
yeah. Okay. So why I have chosen this topic? Because you may be knowing that acute liver problem where SGOT, SGPT level are more than, when in modern books it has been written that when SGOT, SGPT level is more than 400 or 500. It needs to be very critical approach to the liver, and also every doctor should be very cautious about it. But I have treated the cases where OTPT levels are more than 500, approx 1000 to 2000 levels of elevated enzymes, that is SGOT and SGPT. And by giving the simple medicines of Ayurveda, the many patients I have treated, but I will be focusing on only 4 patients because it is not so easy to discuss on all the patients. So how I have treated the cases, how I have approached the cases, so everything will be given to you. I'll share my knowledge, I'll share my experience in front of you. So my dear friends, you just listen one thing and you just keep it in your mind that every diseases approach described in our Ayurvedic classics. You just need to read. I also need to read. Everyone also needs to read on this. So the first thing is that, yes. Next slide. The okay. The first slide is that, my dear friends, whenever we are studying in our PG courses or in UG courses, we are used to doing what now? Whatever anybody is asking about any diagnosis of any disease, we just start about the what? Etiology of the disease, then investigation of the disease, then clinical sign and symptoms later, then treatment, then rest parts. So my dear friends, I would like to say one thing: whenever patient is coming to you, or coming to your OPD for the consultation, why patient comes to you? And patient comes to the OPD with what? That we people need to know, and we should approach first. Why patient comes to OPD with, or why patient comes to OPD, or patient comes to OPD with what? Next slide, please. You just put, my dear students, you may put your answers, whatever question I'm asking in the in my talk, you may put your answers in a chat box. Okay. So patients are always approaching towards the OPD of a consultant by taking some complaints right now. So the complaints may be single or multiple. So a genius doctor always, by taking the complaints, approach towards the diagnosis. Then after approaching towards the diagnosis, then the doctor make a good treatment protocol so that the disease which is happening to the patient will be cured
email खोल के email से email पे communicate
very easily. So my approach will be from both sides. First of all, we will approach the disease from the Ayurveda science, or from the Ayurveda side, what have been described in Ayurveda classics. Then same approach will be given to you from modern sites also. So that's why during the approach of the patients on acute hepatitis, what I have treated in my OPD, so the same patient I have sent to a senior gastroenterologist working in the hospital named Indian Institute of Gastroenterology and Hepatology. So I have taken the help of the doctor after diagnosing the case in my science. In the process described in Ayurveda, I again sent for the more validation of the diagnosis. So, so patient is coming to the OPD with complaints, right? So then next, the complaints may be single or multiple. Next, my dear friends, you may be thinking that sir is not approaching towards introduction or anything else like that. No, I am not approaching towards any introduction. I will just jump over to the case study what I have done in my OPD. Okay, done. So 4 case studies I will be presenting here. Number 1, a 21-year male patient came to my OPD with the complaint of fever, loss of appetite, indigestion, incomplete evacuation, vomiting tendency, feeling of weakness, pain in the abdomen, particularly in the right hypochondriac region for 3 days. My dear students, or whoever following me, you just follow me, and whatever I am saying, some complaints I told. A 21-year male patient came to my OPD. Number 1, fever. Number 2, loss of appetite. Then indigestion, incomplete evacuation, vomiting tendency, feeling of nausea, weakness, pain in the abdomen for last 3 days. Next, a 22-year female patient came to my OPD with the complaint of fever, loss of appetite, indigestion, incomplete evacuation, vomiting, nausea, weakness, pain in the abdomen for last 7 days. The third one patient of 66-year female patient came to my OPD with complaints of poor appetite, indigestion, incomplete evacuation, vomiting tendency, feeling of weakness for 10 days, last 10 days. Next patient a 22-year male patient came to my OPD with the complaints of poor appetite, indigestion, incomplete evacuation, vomiting tendency, feeling of weakness, pain in the abdomen for the last 4 days. So, my dear friends, you may be knowing from the 4 cases what I have discussed here. In the 4 cases, the complaints which are brought by the patient to my OPD, same, almost same complaints. Number one, fever. Number two, loss of appetite. Number three, indigestion. Number four, incomplete evacuation. Vomiting tendency. In some patients, it was vomiting, and in some patients, it was nausea, and it was feeling of weakness and pain in abdomen. So, all the 4 patients approached to my OPD with the same complaints, and many more patients which have already approached to my OPD also with the same complaints. Okay, because the topic will be so vast, so that's why I'm presenting with the 4 case presentations. But the basic difference is what? The basic difference here is only duration. Some patient is having the history of 3 days, anyone is of 7 days, anyone is of 10 days, anyone is of 4 days. But as it is an acute attack, so basically present my the word how the patients what I have treated. So I have got the history of such complaints of the patients of 7 to 10 days. Any patient who has come to my OPD with all the symptoms, the suffering is from 7 to 10 days only. Okay, so my dear friends, so whenever any patients of such complaint is coming to the OPD of an Ayurveda clinician, a Kajiksa specialist, so definitely it will be my duty. I will think from my point of view that how many diseases or how many diseases are there. In these diseases, we will get these complaints of the patients. In how many diseases we will be getting these complaints. So I have already complied the complaints. Next slide, Dr. Preeti, please. So, as a physician, you may be knowing that whenever patient is complaining before us, after the complaint, after receiving the complaint, the basic duty of a doctor is to examine the patient, right now. So that's why I have adopted many parikshas are there, Trivida, Chaturvida, Panchavida, Sadvida, Astavida, Dasavida, Dwadasa, many parikshas are there, adopted by Bruhatrai. But I have applied eightfold of examination given or documented, postulated by Yoga Ratnakara, as you know. स्तनन्य अष्टो परीक्षेत रोगिणम नाड़ी मलंग मूत्रंग जीवहंग शब्द स्पर्श दृगाकृति. I have applied the eightfold of examination pattern given by Yogaratnakara in these 4 patients. So, and also I have divided the eightfold of examination into 2 varieties. Number one, general physical examination. Number two is systemic examination. Next slide, please. And whatever I am discussing right now, all are classically classically I have examined. Classically, everything I have examined what have been described in Charak Samhita. So, general physical examination that I have focused on Druk, Akruti and Sparsha. So, my dear friends, in Druk, I have got icterus. Pallor was absent. That you may say, whatever pallor means to assess Pandu, I have examined pallor, whether the patient is having Pandu or not, because you know that in Koshtashrita Kamala, basically it has been written that Pandurugi jo tu atyarthang pitalani nishavate. So the disease of the Kamala which has happened from Pandurugi after taking Pital Ahara Vihar. So definitely it is the duty of a doctor of such case to exclude Pandu. So that's why in from the Astavida Akruti Drik Parikya I have applied pallor. I have seen pallor from the patient. I have examined whether the patient is pallor or not. So it was absent. So lymphadenopathy I have seen. So lymphadenopathy was also absent, because you may be knowing that lymphadenopathy is also, it is a sparsha parikya, because whenever such type of complaints are coming to us, so that's why we need to approach the patient by the lymphadenopathy, because such complaints may be involving the lymphadenopathy of the patient. So that is a sparsha parikya. Then cyanosis, also it is a drup parikya by the viewing through the eye. I have seen the cyanosis, it was absent. Then skin. So my dear friends, you will be astonished to know one thing, that Skin, in skin I have got Neela Haridra Varna. So in my next slide I will be showing you how particular as Charak Samhita has told Neela Haridra Varna, Neela Harita Haridra Varna seen in case of such complaints. I have found Neela Haridra Haridratvam in the that is Shweta Mandala and also sclera say, and clubbing was absent. And why I have seen clubbing? Because to exclude any type of liver disease. So the next is temperature was present. Then tongue was also yellowish in color, as you know, to detect whenever any such cases are there. So definitely you may go through the tongue examination, and that is also coming under the osto. That has been told that nadi malamutrang jivang sadasparsha durga jiva parikha is there. So that's why I have examined the tongue examination. So sabda was normal. Then mutra pariksha I have done, that was dark and burning. So it has been also described in our shastras, this haridratvam mutra varna. So and also it was burning in sensation. So burning I have seen by the complaints from the patient, as it is a general physical examination. So burning cannot be assessed by the examination. Burning can be felt. So it's a review, but it is please don't take the burning sensation in general physical examination. It's a sensation of review taken from the patient. So mola parikya, that I have not observed in case of the patient. Next slide, please. Then when the patient approached towards me with the complaints, first I interrogate the patient with the general physical examination, Druk Akruti Sparsha Parikha documented by our great Maharshi Yog Ratnakar. Then after that, I proceeded towards our systemic examinations. So in the systemic examination, why I am going through the systemic examinations? Because my dear friends, that Yog Ratnakar has already told that you need to examine very nicely. So and in Dasavidha Parikya, Charak has also emphasized on it. So that's why, although I am giving modern terms, but my approach was Ayurvedically, or my approach was classically. So in CNS, there was no problem. Patient was conscious and oriented, and there was no focal neural deficit. And in Nadi Parikya and cardiovascular system, I have got these kind of patients, or these patients, a systolic blood pressure ranging from 110 to 130, and diastolic blood pressure ranging from 70 to 90. And in the nadis, pulse was 72 to ranging from 72 to 76 per minute. And your first heart sound, second heart sound was audible. There was no murmur and there was no additional sound. Then in respiratory system, whenever I examine, so that is called Imami Darsana Sparsana Parikya Roginam 1. Sparsana Parikya is there. So by the auscultation process, I have taken the auscultation of the chest, and the breathing sound was normal vesicular breathing sound. Chest was 100% clear, and the respiratory changes or respiratory rate was ranging between 18 to 20 per minute. So in gastrointestinal system examinations, or you may say our Annava Srutas examination, so in Annava Srutas examination, bowel sound was present. So as for my auscultation, bowel sound was very good. And as for the examination of the abdomen, that is Udar Parikya. So in Udar Parikya, the Udar was soft and scaphoid, but in all the cases, the abdomen was very tender. Whenever I am putting, maybe examination of the liver by the bimanual percussion or single manually by giving pressure, whenever your hand is moving from the right iliac region towards the liver, so that region was very tender. So I may be saying one thing is, although liver and spleen was not palpable, but there was pain. But there was pain in that, liver area, in the subcostal area below the liver, and also pain in the epigastric region. So I have got the pain from all the patients. So that was the systemic examination. So my dear friends, patient approached towards me. First I collected the symptoms. Then I went through the examinations. The first general examination I did, then systemic examination I did. Then the next important vital point, my dear friends, is systemic review. Dr. Nihar, please, next slide. So what is the importance of review? So review means, my dear friends, after the examination means what you will inspect, what you will put the Trivida Parikya as documented by Ashtanga Hridaya, Darshana Swarsana Parikya Roginam. After Trivida Parikya, definitely you need to ask some questions related to the systems again. That is called review. Review means what review will get from the patients. That is not an examination. That is a feedback from the patient, interrogation with the patient, and what will be given or what will be told by the patient, that is a review. So as I have taken the review from the patient in Manabharaswatas or central nervous system, brain and spinal cord related any, whenever any questions I raise, patient told that he has no issue or she has no issue. And in cardiovascular system, then in respiratory system, there was no issue, no review I got from the patient. But in case of GI system, I got the review of poor appetite. All the patients told poor appetite. Then indigestion, all the patients told. Incomplete evacuation, all the patients told. Then vomiting tendency, then nausea, and the very although one symptom I got, a review I got from the patient, that is called weakness. So my dear friends, whatever I went through the patient after collecting the chief complaints from the patient, then after examination, then eightfold of examination, then threefold of examination, tenfold of examinations. It is it is not possible on my part to cover all the parikyas, but by giving the Trivida Parikya, Dasavida Parikya, Panchavida Parikya, and all the Astavida fold of Parikya, I got these kind of things from the patients. So definitely, what will be my next approach? So definitely, my next approach will be what? My next approach will be the complaints which have been expressed by the patients. I will get these complaints in which disease, or in which context of the Charak, or in which context Charak has documented or Brohatra has documented that this type of complaints will be found. Suppose, next slide please. Suppose one symptom, symptom wise I will be discussing in front of you. Suppose uh, 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 then next is, after getting the collecting the, after doing my physical examination, I will be going to what? History of present illness. My dear friends, it is very important. Why? Because first collection of patient chief complaint, then thorough examination, Trivida, Panchavida, Dasavida, Astavida, Dwadasa. Then after thorough examinations, then systemic review. Then after the systemic review, it is very important to take the history of present illness. जो आयुर्वेद में कहा गया है कि आपका वर्तमान कालिक, आपका इतिहास, आपका इतिहास और वृत्ति क्या है, कि पेशेंट का इतिहास क्या है. So in the history of present illness, I will be focusing on 2 points what have been described by our classics. One is sudden onset. All the patient told that, sir, my onset of the disease was of sudden. Suddenly I developed, when I get up from the bed, or when in the evening time, sir, suddenly I developed fever, and after 2 hours I developed vomiting tendency. Then after 2 days, loss of appetite, then pain in the abdomen. Then, sir, there was no good evacuation. So it was sudden of origin, not taken any medicines. So it was a very good news for me, and also it was very good approach for me. It was easier for me to treat them because they have come to me without taking any medications. So that's why it was very easy for me to give a good Ayurvedic approach to the patients, because these patients are from my university staffs and also students. So, and in the history of present illness, I got a very peculiar history. When I asked the patients that, have you taken any water or food outside? So all the patients, I got the information that all have taken some kind of diet from outside. Some has taken biryani, some has taken chow mein, some has taken pizza, some has taken diet or ordered from Zomato, and also some has drank outside water. So when they told me the history of intake of such type of diets from the outside, actually I was very happy. Doctors should not be happy, but I was very happy because when the doctor's diagnosis will be more nearer. So that's why when in the same time when doctors will be getting relevant history, so definitely doctor will be happy. So my dear friends, I will be loving to highlight one thing here, that why I am giving this sloka here, because the relevancy of this sloka is here to put some authenticated diagnostic criteria to the complaints defined by the patients. So this Nidan has been told in Charak Samhita, Atiushna Lavanakyara Vidahi Amla Vidahi Garashanat Mithya Sansadanat Rukhya Virida Shuchi Bhojanat. Then you come to, then third line, Srutasang Dushanat Amat Sankhyavat Ati Purnat. Next is Ati Santicha Doshanang Papa Karmacha Kurvatam. Then next is उदराणि उपजायन्ते मंदाग्नितं विशेषतः. खेल खत्म. I was very happy. Patient has the history of taking all the property of Atiushna, Lavana, Khyara, Vidahi, Amla, and also Viruddha and Asuchi Bhojana. They definitely after taking this kind of diets, what will happen? There will be obvious development of the Mandagini. When there will be Mandagini, there will be, it has already been told by Charak and also our Maharishi, when there will be Mandagini, so there will be formations of Amo. It has been told. Jathagni Dorvalya Vipakastu Jara Sasama Sangyakam Sarvadosa Prakopanam. When there will be Ama, there will be aggravation of all the dosas. So at that moment I was very happy because my diagnosis was very nearer what I was thinking about. Then after the history of present illness, then I proceeded to history of past illness. Proceed. Next slide, please. Doctor, please, next slide. In the history of past life, there will be two types. One, any medical history or any surgical history related to mind or friends, you just remain or you just keep it in your mind that whatever I was thinking, my focus was from the first line. Whatever complaints before complaint in front of me. By taking the complaints, I am approaching chief complaint. After the chief complaint, I am approaching towards the clinical examination, the Dasavidha, Dwadasa, Panchavidha, Ashtavidha, Dasavidha, Parikshas, Trivida Parikshas, then next thorough examination, then history of past, present illness, then history of past illness. So, fortunately, all the patients were not having DM, diabetes mellitus, hypertension, Madhumeha, Raktagata Vata, thyroid, dyslipidemia, and Meda Vikriti, liver disease. Nobody was having no history of like that. Then surgical history, no relevant surgical history was also found in case of all the four patients. The next is the next slide, please. Then it is very important for the doctor that definitely after collecting the information and one clue I got that he has taken in the history of present illness, he has taken some kind of diets which are those of Prakopana or Dusita Ahara, which has already created ama or mandagni inside the person. So definitely personal history will be something relevant to the patients. So two patients are vegetarian, two are non-vegetarian, also mixed. So in case of personal history, I have taken one was widow and three were unmarried students, and there was no history of addiction, no narcotics, and also no history of any habit like tea, coffee like this, and no history of any type of narcotics I got from the patients. So personal history excluded here. Next, I proceeded to next. Next, I took the history of definitely the important history is our drug history, because if anything is happening, there may be possibility of the long history of intake of any kind of drug to the patient. So my dear friends, I would like to highlight one thing, that one of my patient was continuing some drugs containing guduchi and also manjista like this. And why I told some patient, one patient, that 66 or lady widow patient was continuing some Ayurveda medicines containing guduchi and manjista. Why I told that will be giving the I will explain about that in the later slides. So no relevant of drug history. Why I have written, because some drugs they have been not continuing, which will be having any hazardous effect on the body, so that patient will be developing such complaints. So drug history is excluded. Then please next to come to next slide. Then family history. So why family history is important? Because you may be knowing that if any patient is complaining such complaint, so definitely so a curiosity is developed in the mind of the patient, mind of the doctor, that is there any possible history in the family member, so that it will be more easy to diagnose what is the case, why the complaint, and what is my treatment approach, what will be next and next. So that's what family history was also nil, what I was expecting in case of madhumeha, raktagata vata, dyslipidemia and thyroid, liver disease. So nothing was, no such relevant family history related to ever complaint. So it was also excluded. Next slide, please. Then differential diagnosis. My dear friends, it is the very vital part of an Ayurveda physician's. Why? Because in our treatise, in our Samhita, for a typical complaint of a patient, many differential diagnoses have been written in our Brihatrai. So that's why at that time I was also very curious, and I was also scaring that whether I will be coming to the concluding point or not. So whatever the complaints, first fever was there, poor appetite was there, indigestion was there, incomplete evacuation was there, nausea, vomiting was there, feeling of weakness was there, pain in the abdomen was there. So I tried to collect how many diseases are there in Charak Samhita or in Bhratrai. Fever is the complaints, and also is the upadrava is there in that disease. So more than 100 diseases I got, that fever is present as a complication. Fever is present as a complication upadrava, and also as a symptom like fever, kama jwara is a fever. Any Paitika jwara you will be getting fever, poor appetite. So like in um, these are the complaints of the patients. What complaints the patient told during the time of consultation. So when I started collecting the differential diagnosis of each and every complaints of the patient, so near about 1,000 diseases stood in front of me. Fever has 1,000 diseases. Poor appetite is 1,000 causes. Indigestion is 1,000 causes. Incomplete evacuation is 1,000 complaints. Like one example I will be giving. Suppose one complaint is there with the patient Chardi. So Chardi is the complaint, or Chardi is the, you may be saying Chardi is a symptom of avirikta lakshana. Chardi is a complaint of Nija Sotha Karana. Chardi is a upadrava of Sotha. Chardi is a symptom of Bataja Jwara. Chardi is a symptom of Kaphaja Jwara. Chardi is the Purvarupa of Raktapita. So, my dear friends, so Chardi is a symptom what I got from my patient. And when I started searching from the classics, I was puzzled because Chardi is a symptom I got from more than 200 diseases. So, my dear friends, then I got the right approach after that. That will be cleared in the next slide. Please, next slide, madam. Above complaints are manifestations of many diseases, but you will be very astonished to know all symptoms are seen in one disease. Can you diagnose the disease? Can you name the disease in the chat box? Let me see in the chat box. Let me see in the chat box. It is request to my students that I told that whatever the complaints I collected, I got from the patients. These complaints, when I analyzed each and every complaints, I got these complaints are found from hundreds, thousands of diseases. But Charak has so meticulously documented all the symptoms are found in one disease. Can you diagnose the disease? Appendicitis, acute hepatitis. No, 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 my dear friends. The diagnosis should be from specially classical. What Charak has told, what Susrut has told, what Bhagavad has told. Can anyone? Yes, please. I'm excited to know from you because I was also excited at that moment when I got from the Samhita, because I used to diagnose the case by taking my little bit of knowledge, because still Charak Samhita is in front of me. I just open Charak Samhita, see the symptom match, and diagnose the disease. Appendicitis, acute hepatitis, Bisama Jwara, Kamala, Udaroga. Yes, yes. One of me, Dr. Jayasri Khunte, yes, you are coming closer to the diagnosis. But which Udaroga? But which Udaroga? Because you know that Udaroga is of how many types? Anyway, this is not the time to take class of my juniors or students. Kapha Udaroga? No, a particular Udaroga is there. A particular Udaroga is there. Bhai Namaskar, my senior Dr. Somnath Misra, yes, my Namaskar to you. So a particular disease is there where all the symptoms I got from the patient, I got. Very excited to know from you. Yes, yes. A very good afternoon to all of you dignitaries. Professor, okay. Okay, sir. Namaste. Okay. So, shall I proceed or you will guess? Shall I proceed or you will guess? Because I am also excited to share my knowledge. And on the particular day, I was also excited that how meticulously our God, Charak Samhita, our God, my God has written all the symptoms in one disease. Jakrut Dalyodara. Dr. Jayasri. Yes, yes, you are coming very closer to it. Yes. So that disease is, that is Jakrut Bruddhi. Or you may say Jakrut Dalyodara. Very nice answer. Next slide, please. And you just see the relevancy. How Charak has documented. You'll be astonished to know. Just we need to just recycle our mind. You see, Tasya Rupani. You see, Tasya Rupani. One minute. Huh. Tasya Rupani Daurvalya. Is it present in the patient? Please put yes in the chat box. Aruchaka. Is it present in the patient? Abhipaka. Is it present in the patient? Virtue Mutra Graha Virtue Mutra Graha. Incomplete evacuation. Virtue Graha. Incomplete evacuation. Mutra Graha. Burning micturition. Mutra Graha means urination was there, but during the time of urination there was burning. Also, Daha is not here, but you may take in the sense. Virtue Mutra Graha. Tama Pravesha. Tama Pravesha means weakness was there. So that's why patient was having what? तमा प्रवेश आंखों के सामने अंधेरा छा जाना. Then pipasa, thirstiness was there. Chardi, thirstiness I got from the patients. I have not documented. Chardi was there. Then murcha, murcha means patient was so weak that he was or she was saying that, sir, now I am not able to walk. I'll just fall down. Murcha tendency. Angasada. Angasada. Angasada means what? Angasada means angasithilata. So it's a form of weakness. Next is kasoswasa. My dear friends, it is a very good symptom. Kasoswasa, and it will be astonished to know. Charak has documented that kasoswasa is a disease related to Yakrut. And that disease has already been documented by, or symptom has already been documented by modern science. So where Yakrut is there and where Kasoswasa is there, both are the distance relations. But Kasoswasa will be astonished to know that Kasoswasas are also documented by modern people, and also same has been documented in Charak Samhita. Then Mrudu Jwara. In the context of Mrudu Jwara, I would love to say one thing, that all the patients approach towards me without any high grade fever. All the patients just 100 to 101 fever. So that's why perhaps Charak has documented Mrudu Jwara. Anaha. Anaha means already Amo was there, so definitely Anaha in every patient. Then Agni Nasa. Agni Nasa was there, I have already told. Then Agni Nasa Karsya. Karsya in the term of Durbalata. I have already told that patient will say that feeling of weakness, and feeling of weakness means Daurvalya, or you may say Karsya. That was also found in case of the same complaints also I have got from the patient. Then Asya Vairasya, my dear friends, these patients I have already told there was poor appetite. So definitely when there is poor appetite, Asya Vairasya was also there. So a 66-year old lady or widow lady, she frequently complains, sir, I am having very bitter taste in my mouth. Sir, I am not getting any taste, whatever diet I am taking. Sir, जिसको हिंदी में बोलते हैं सर मुझे पीता पीता सा लग रहा है, मेरे मुंह में एकदम मिठास नहीं आ रहा है, एकदम बहुत खराब लग रहा है. Charak has same has documented Charak. So how nicely he has described. Apicho udaram aruna varnang vivarnang va. Very nice. Aruna varnang vivarnang va. Neela harita haridra rajim. Oh, nicely Charak described. Neela harita haridra rajivi. You will get Neela harita and haridra raji. I have already described that you will get icterus, jaundice, yellow discoloration of the sclera, and also skin. And my dear friends, You'll be confused to know one thing, that Charak has mentioned here Neela Varna. I think it will be slight little bit confusing to you. Why? Because Neela Varna you may not have seen. Yes, Neela Varna I have got, and Neela Varna modern people, modern doctors is also so told that Neela green, Neela Sabuja, Haridra Varna you will get from this kind of patients. Green and yellow type of color. एवं एतत् जकृत अभी दक्षिण पार्श्वस्थ कुर्यात्. खेल खत्म. जकृत अभी दक्षिण पार्श्वस्थ कुर्यात्. यकृत के बारे में वर्णन किया गया है. तो whatever complaints my patients presented before me, my dear friends, please write in the chat box all the complaints, all the symptoms are there in the Charak Samhita or not. I'm just watching my reading the chat box. Hello, my dear friends. Hello? You just put all the symptoms, whatever I got from the patients. Are these in the Charak Samhita? Yes, na? Yes, all are in Charak Samhita. So, I was so happy to diagnose the disease because I was very near to, I think I 99% I have diagnosed from Ayurveda point of view. So, each and everything I got from the Charak Samhita. Next slide, please. Next slide is nothing but it's just a joker type of diagnosis guess. I thought that diagnosis will be difficult or anyone may not guess, so that's why I put. So you see, whatever I told, whatever Charak told, everything diagrammatically and everything in the image wise, I have written here. I have documented here. So again, I will go to chat. My dear friends, you just got all the complaints now. What I got as a chief complaint from the patient and what described in the Charak Samhita and what you have already guessed, thanks to my big bro Dr. Somnath and also my junior Jayasri Khuntia. Much thanks to you. And also Sam has been documented as a image form. Right now? Okay. Next is next slide. Next slide. What is the diagnosis? What is the diagnosis? All the symptoms I told. Finally, evam about jakrutapi. All the symptoms we are getting from the jakrut. So that's why the disease is what? Jakrut Bruddhi. So what do you mean by hepatitis? That's why in my first slide I didn't tell you about the hepatitis, because hepatitis, you know that it is whenever TIS is joined any word, so it will be an inflammation of infective origin. So that inflammation has already been described by the Charak Maharshi 300 years ago. So thanks to Charak and my salute before the lotus feet of Charak, how meticulously he has described. Then come to, and from Ayurveda point of view, I diagnosed this is a case of Yakrut Bruddhi. This is a case of Jakrut Bruddhi. As we are Alpa Buddhi or Manda Buddhi Vaidya, Charak has described in Sutrasthana, Sadvirachana Satashrita Madhya in 4th chapter, what he told, that I am writing everything for the Manda Buddhi Vaidya. So as we are Manda Buddhi Vaidya, so sometimes we need to approach modern subjects. So my dear friends, so modern approach, we definitely take the help of modern approach from two aspects. One, to concrete the diagnosis, and second is for the ease or for the creating confidence within the mind of the patient, within the mind of the doctor. And I normally do, because after the treatment of my patients in the university, many queries come to my department, to my MS, that what has happened to the patient, what investigation you have done, how you have approached the patient. So that's why Ayurvedically or classically, in all cases, I did like this, and from modern point of view, I also approach towards the disease. So next, you come to modern approach of the disease. So Ayurveda approach, I clear, my dear friends. Don't forget the diagnosis Jakrut Bruddhi. Come, Kal Khatam. Next is modern. Next slide, please. Same is here in the modern science. Jaundice, yellowish or greenish pigmentation of the skin and whites of the eyes. Already told, my Charak has told, my God has told. Harita, Haridra, Neela, Charak has told. Then symptoms, abdominal pain, weight loss, vomiting, then fatigue, dark urine. My Charak has already told. Please proceed to next slide. I think there is nothing to do more to it. Then next, approach to the patient with modern investigations. It's a standard guideline given by the your international textbook, that is Internal Principle of Medicine's Harishan, updated 21 updated version. So what is the algorithm for the patients with jaundice? What should be our approach? So you may be seeing two-fold of treatment, two arrows are there. First you see history, focus on medication and drug exposure. In my history I have already taken this. Physical examination I have already done. Okay, then next is lab test, bilirubin with fractionization, ALT, AST, alkaline phosphatase, prothrombin time and albumin. The main headline below the algorithm for patient with jaundice. You see in the bracket or in the square just below the algorithm for patient with jaundice. What has been written in the box below the algorithm for the patient with jaundice? What has been written? From modern point of view, it has been written history. Have you covered the history? Please put your answer in the chat box. Yes. Have you taken the focus on medications? Yes. Have you taken the history of drug exposure? Yes. One of my patients was taking Mangista and Guduchi. Physical examination, have you done? Yes. Lab test, have you done? Yes, I have done. But what next I will tell you. Then bilirubin with fractionization. So you come to just left and right position of the box. You just watch to the left arrow of the box. Are you getting my point? You just see the left position or arrow given to the left side of the box. It has been written that you see isolated elevation of the bilirubin. But isolated elevation of the bilirubin. Then again an arrow is there attached to the box, isolated elevation of the bilirubin, direct and indirect. Can you see? Isolated elevation of the bilirubin, it is in the box, and the right side of the box there is an arrow for direct hyperbilirubinemia. Yes, direct hyperbilirubinemia, yes, and in the down indirect hyperbilirubinemia, yes. So that part needs to be approached from the modern point of view. So that's why I have not approached. I just sent the patient to a gastroenterologist. So in the indirect hyperbilirubinemia, next causes are, please, Dr. Niyar, please bring the cursor to that. Indirect hyperbilirubinemia, the causes are drugs like rifampicin and probinate, yes. Probinate, yes. So in the drug history, have I told these drugs patients had the history of taking these drugs? No. Next is inherited disorders. So in the family history, had I mentioned any type of inherited disorders? No, excluded. Then hemolytic disorders, infective erythropoiesis. Then in any past history, had I mentioned any hemolytic disorders? No. So isolate in the on the subfold of isolated elevation of the bilirubin, the folder was indirect hyperbilirubin was excluded. I caught in the OPD that this patient may not be of this kind of history. Left, towards the left, dear Nihar, yes. So isolated elevation of bilirubin chain was excluded from the history, excluded. Yes, isolate, yes, excluded. Yes. Then next come to direct hyperbilirubinemia. In the direct hyperbilirubinemia, the bilirubin is more than 15%. So whatever patients, I sent the patient to the gastroenterologist, so bilirubin was assessed, but the direct bilirubin was not 15%. Cross, excluded. So the left chain of the algorithm was excluded, my dear friend. Then we'll think about the right chain. So in the right chain, bilirubin and other liver test elevated. So next chain is whether bilirubin and other liver tests are elevated or not. So first thing is bilirubin. So in the bilirubin, you will be getting total bilirubin, direct bilirubin, and indirect bilirubin, whether it has been raised or not. Next is other liver tests like SGOT, SGPT, alkaline phosphatase have been raised or not. So in my cases, so please, Dr. Nihar, please come to the left branch of again bilirubin and other liver test elevation. Yes, first hepatocellular pattern. Hepatocellular pattern. Yes, yes. Put a tick on it. Yes, hepatocellular pattern. ALT and AST, that is SGOT and SGPT elevated out of proportion to alkaline phosphatase. See the table. Yes, in my patient, SGPT, ALT, AST levels are elevated. Yes, put a yes on it, please, Dr. Niyar. Please put yes. I got in my patient. Yes, it is yes. Next is EPS. Then it is viral serologies have been done or not. So if it is positive, so it is of what origin? Either it is viral, or it is toxicology, or it is due to ceruloplasmin, or it is due to ANA, SMA, or SPP. So in the first viral marker test, I got all the markers. What? I got all the markers, means hepatitis A. I will show. I will show the diagnosis. So I will got all the viral markers. I got all the viral markers negative. Whatever the gastroenterologist described, or whatever the gastroenterologist prescribed, so I got that all the viral markers were negative. So viral serology was negative. Yes, viral serology was negative. Then when viral serology was negative result was there, then again next is additional virology testing. CMV, cytomegalovirus, DNA, Epstein B virus, antigen, hepatitis D antibody, hepatitis E IgM if indicated. Then all the, you know, the next chain was not, the next chain was not counted by the gastroenterologist. Then gastroenterologist, after doing the viral marker test, then jump over to next. Dr. Preeti, cholestatic pattern of alkaline phosphate is out of proportion. Cholestatic pattern. Bilirubin and other liver tests have two chains. Yes. In the cholestatic pattern, a doctor jumped over and he did ultrasound. He did ultrasound. And after the ultrasound, every patient was found normal. Then, in the below the ultrasound, dilated dots, extrahepatic, cholestatic, all the things he saw. Then when it was negative, then you come to CT, MRCP, ERCP. Dr. Preeti, please come to ERCP. Endoscopic retrograde cholangio pancreatography. Okay. So in the ERCP result was also negative. So doctor was confused. Gastroenterologist was confused. Sir was very close to me. So sir made a call to me. Dr. Sanjib, everything, whatever I am doing, every test is negative. I need to test. I need to do more tests because two chains are right now blank. Two chains are not tossed right now. Like additional virology testing, liver biopsy. So last chain MRCP, liver biopsy, again liver biopsy. So the last three tests remained. So doctor was confused. At that moment, the attendant of the patient and the son of the patient told the doctor that, sir, my mother was taking some Ayurveda drugs like Manjista and Guduji. So instantly doctor told, why didn't you tell me in the earlier stage? Because of the liver profile and because of the enzymatic activity was due to toxicity of Ayurveda medicines. And doctor recently made a call to me and told me that, Dr. Sanjib, the patient has nothing has happened to the patient. This is acute hepatitis and this is due to some Ayurveda drug intoxication. So I was shocked. Then come to next slide. Come to next slide. Please come to next slide. My prescription. The cross mark of the slide has been put on the prescription. Please don't mind. My prescription. And you can see Yakrut Vikara, Ajirna, acute hepatitis, Kamala, APD. I have given differential diagnosis on my patients. Same was advised. The prescription was for I have advised same LFT. You may see LFT, then serum amylase, serum lipase, HbS-Ag, CBC, TLC, ESR, CRP, SCB, everything I have done. Everything was normal. Then come to next slide, please. Then come to next slide, please. You see, patient has been tested. This is for viral markers. This is for ultrasound. This is liver function test, other test. This is ERCP, everything normal. Then you will be astonished to know the next thing. Please come. Can you put the diagnosis made by the doctor in the chat box? Diagnosis, acute hepatitis, drug induced, Ayurvedic. You see? The amazing thing I will say right now. Can you see what doctor finally diagnosed? Drug induced, Ayurvedic. So being an Ayurveda physician, I watch, as I watch in a very, you may be feeling my emotion. Drug induced, Ayurvedic. Can you getting? Please put yes. Then I will come to very astonished, it is a shocking news and it is a demoralizing news, but there will be pleasure news from my side. Don't worry. Are you getting it? My dear friends, my juniors, please put yes. It cannot be. Dr. Kapila, yes. Yes, I'm coming to the point. I'm coming to the point. Why had he taken Guduchi and Manjista for a long time? Dr. Jajra, I don't know why he had taken Guduchi and Manjista, but it was prescribed by some other drug or other kind of ailment. I don't know. I had not prescribed the same to the patients. Anyway, but that will be proven false that this is not due to drug induced later on in my later slides. Okay. Dr. Priti, next slide, please. You see, my dear friends, you see, LFT before treatment, it was my approach. Modern doctors told it is Ayurvedic drug toxicity. Okay. Patient 1, patient 2, patient 3, patient 4. Okay. Total bilirubin was 9.8. Direct was 8.0. Indirect was 1.8. SGOT was 127. SGPT was 652. ALP, alkaline phosphate, was 197. I think it is a big achievement for the Ayurveda fraternity that such huge amount of SGOT and SGPT people are consulting us and getting the benefit. Then patient number 2, total bilirubin 5.9, direct 2.9. Then indirect just to subtract and get SGOT 1840, SGPT 2160, ALP 775. Patient number 3, total 2.6, direct 1.4, indirect you can subtract and get SGOT 129, SGPT 75, alkaline phosphatase ALP 170. Patient number 4, total bilirubin 1.38, direct bilirubin 0.29, indirect 0.09, SGOT 21.7, SGPT 30, 13.9. Then viral markers were negative. Just I have taken these categories of liver function test before giving my medicines. And the very good news for all the practitioners that after coming from the gastroenterologist, the patient directly told me, sir, if I am taking the medicines, I'll take your medicines. And her SGOT was 127 and SGPT was 652. And the next patient was our student. He was also sent to allopathic, sent to modern medicine and diagnosed in this way. And he told me, sir, if I have to take medicines, I'll take only your medicines. SGOT was 1840 and also SGPT was 2160. Okay. Then I started my treatment approach. Please, next slide. My dear friends, what will be the treatment as Jakrut is concerned? So that's why Nidan Parivarjana is the first thing that I have already told. I have already told. Ruksha, Tikshana, Amla, like Ahara should be avoided. The next, Jakrut has been affected here. So can you tell me, Jakrut is the Mulasthana of which Shrutas? Already I have written the answer. Jakrut is the Mulasthana of which Shrutas? Jakrut is the Mulasthana of Raktava Shrutas. So what is the treatment approach to the Raktava Shrutas? विरेक उपवास मुख्य श्रावण विरेक उपवास मुख्य रक्तपित्त हरिक्रिया विरेक फर्स्ट लाइन ऑफ ट्रीटमेंट इज विरेक उपवास मुख्य रक्तपित्त हरिक्रिया तो फर्स्ट लाइन ऑफ ट्रीटमेंट फॉर रक्तवर्षुत दृष्टि इज विरेक इज विरेचन फर्स्ट लाइन ऑफ ट्रीटमेंट इज विरेचन सो यस थैंक यू डॉक्टर सोमनाथ Thank you. So, Birek Upavasa Muksha Raktapitta Harikriya. Then, my dear friends, question may be coming to your mind. Sir is saying Virechana. Yes, Virechana. So, question may be coming to your mind, sir, which type of Virechana? Because we have heard that we know that Virechana, drug-wise, it is of different types. Sankshodhan-wise or Panchakarma-wise is different. Like Nitya Virechaniya, like your classical virechana, like if we are planning for any virechana therapy, we have to go for proper dipan pachan, then snapan, then abhyanga and shradana, then virechana ausadi, then virechana. So this is a virechana. And next virechana is what? Nitya virechana type of drug. Every day you will add a drug that will be giving nitya virechana. And next is what? Which type of virechana? Next is drug wise virechana. What Acharya Sarangdhara has indicated. So, my dear friends, as it is an amavastha, as it is an amavastha, and as patients are suffering a lot, so that's why many complaints I told now, patients were having fever, patients are having weakness, pain abdomen. So that's why to do classical virechana, I need to give Dipan Pachan until Dipan Pachan Lakshana is achieved. So that's why when I'll give the Dipan Pachan and then Snapana, up to that time patients symptoms will not be resolved. So that's why I suggested or I started giving just Dipan Pachan of one variety documented by Sarangdhara. Please, next slide. What has been described by Sarangdhara? Sarangdhara is documented 4 types of virechana. Anuloman, Sankshan, Vedan, Raichan. So, Anuloman, Haritaki, Sankshan, Krutamalaka, Vedan, Katuki, Raichan, Trivrut. So, my dear friends, it is very important to know in which condition, which virechana drugs is to be given. Which virechana is to be given? No, all the clues I will not give to you because you have to read. Because if I am saying everything to you, nothing will be left to read for you. So one example I am giving. You people know Krutamalaka, na? So have you ever seen goat, chaga excreting the stool? What is the constituent of the stool? It is like चने टाइप का होता है ना, छाग का जो स्टूल होता है, ये हमारे जैसा स्टूल होता है क्या? नहीं होता है. तो मैं एक एग्जांपल देता हूं. ये जो स्टूल है ना, अगर ये स्टूल किसी को हो रहा है तो हम देंगे कृतमालक, यानी आरगोद का कुछ प्रिपरेशन देंगे। बाकी आप लोगों का, बाकी आप लोग चिंतन करेंगे। और एक भी मैं आपको क्लू देता हूं, यहां जो दवाई, इन दिस कॉन्टेक्स्ट आई हैव गिवन कटुकी। व्हाई? बिकॉज as Raktava Sotadrushti is concerned, as Jakrut is concerned, so Pitta Virechana drugs is needed. Pitta Virechak drugs is needed. So drugs, whatever we will give, that will be having Pitta Virechan property. So that's why Vedaniya drugs I have chosen here. Maladim, Avadham, Jadbadha, Ba Pinditai Malai, Vitva Adha, Patayati Jad, Vedanam Katuki Jatha. That will be having Vedana effect. And my dear friends, I will love to highlight one thing here. Same was discussed with one modern doctor of community medicine. The doctor, you are giving Virechana in this context? Yes. Are doctor, same thing we are also doing. So I asked what you are doing. Now in the ICU patients of hyperbilirubinemia, like bilirubin 30, 35, 40, we are just giving Dufalac syrup to purgate, so that many bilirubin, much amount of bilirubin will be excreted. And you see, Sarangdhara and Charak Maharshi, our God, has written the same thing 200 and 300 years ago. That a मूर्ख वैद्यो भेदन दे दो आप, मलादिमा वदम जद वधंगवा पिंडिते मलई भित्वा अधपातायति दत वेदनम कटुकी जथा, कटुकी का कुछ ड्रग्स दे दो, बात खत्म हो जाएगा। नेक्स्ट स्लाइड प्लीज। बाकी दो विरेचन, बाकी दो अनुलोमन, you have to think in which condition you will give. Then I have given two drugs to the patients. One is Agnitundi Patti, and next is Potal Katurinadi Kasai. Agnitundi Patti of Dabur Company, Potal Katurinadi Kasai of Dhanvan, Sri Vaidyaratnam Company. Okay, so the sloka of Argavardhani Patti is too long. So Suddha Parat, Suddha Gandhak, Lauha Bhasma, Abhraka, Tamra, Trifala, Shuddha Silajit, Shuddha Gugulu, Chitraka Mulachurna, Katuki Mula. So my dear friends, why I have chosen this drug? So it will be taking more hours for me to discuss about. For individual drugs, I can explain you why I have taken. I'm just giving one, I'm just focusing on two drugs. Okay, three drugs, Chitrakamulo, Katuki Churna. I can focus on many drugs, but you just know Chitrakamulo, Katuki Churna, and Abraka Vasma. Whatever any disorders related to Annava Shrutas, you must get Abraka as a component. Why? I cannot answer right now because you have to read. Next is Katuki as a Vedanya. Next Chitrakamulo. Amadoswa there for Deepan and Pachan. Then I have not put Sloka for Potala Katunadi Kasaya. My dear friend Nihar has put this one. So the sloka is Potala Katurini Chandanang Madhusravana Gudichi Padhan Vitam Nihantika Fapita Kasta Jwaran Vishamam. So Kamalam. So these type of drugs I have given. So what should be the dose of the drugs? Please proceed. Next slide, please. Arogavardhini Bhatti, one tablet twice with lukewarm water before food for 45 days I have given. Again, you shall ask me, sir, what is the dose? Yes, 250 milligram twice BD with lukewarm water before food. Some things I have hidden here. Then Portal Cotinadi Kasai 10 to 15 ml twice with lukewarm water before food for 45 days. Okay, so my dear friends, complications will arise from the patient side when prescribing Portal Cotinadi Kasai, because at that condition patients are already in asya, vairasya, then jwara, then vomiting tendency. Patients will complain that, sir, Potala Katunadi Kasai we cannot take. It is very bitter. If we are taking it, we are having again vomiting. So my dear friends, no need to give at a time 10 to 50 ml twice. No, you just divide it. 5 ml in the morning with more dilution, then 5 ml afternoon, then evening, then at night, what I have done. Then next slide, please. देन पथ्यापत्य क्या होगा? चरक ने बढ़िया बनाए हैं, मतलब वर्णन किए हैं। इज ऑलरेडी डिस्क्राइब्ड इन चरक सूत्रस्थान 5th चैप्टर मातृशक्ति अध्याय। षष्टिकान सालिमुद्गाश्च सैंधव आमल के जवान। ओके, आंतरिक्षं पय सर्पी जांगलम मधुच अभ्यसेत। षष्टिक शालिमुद्गांश, षष्टिक शालिमुद्गांश, षष्टिक अन्न, शाली अन्न. Same allopathic doctors are giving, but excessive carbohydrate to take. षष्टिक शाली, and first line in Charaka Samhita is षष्टिक शाली, rice. मुद्गांश, मुद्ग जूस I advise the patient. वो फॉरेन वाला मुद्गा जूस नहीं है, आजकल स्प्राउट बोलते हैं ना, स्प्राउट, नो स्प्राउट. रात को पानी में मूंग को भिगाओगे, सुबह उठ के वो मूंग को थोड़ा उबालना चाहिए, उसमें सेंधा नमक, गुड़ और आंवला चूर्ण मिला के उसको खाना है, वो है मुद्गा जूस. और हम लोग स्टाइल में आजकल बोलते हैं ना स्प्राउट. मैंने आपने सुबह क्या लिया? मैंने स्प्राउट लिया है. व्हाट स्प्राउट? दिस इज फॉरेन कल्चर. डोंट टेक एंड डोंट से लाइक दिस. मुद्गा जूस, सैंधव टोल्ड, आमलकी टोल्ड, जवान टोल्ड, अंतरिक्ष नॉट अवेलेबल. पयः, दूध लेना है. व्हाई दूध? बिकॉज इट इज विरेचनीय. दुग्ध अभी विरिच्यते, ठीक है. दुग्ध जांगलंग, मधु भी लेना है. यू हैव टू टेक मधु. व्हाई मधु? व्हाई मधु? एनीबॉडी? कट्टमलं लवणं पीतं वर्धयति, कषाय तिक्तं मधुरा तेन समयन्ति. So madhu is certain kasai rasa. So that's why as pitta is involved, so that's why madhu. Cha abhyaset. You have to. Yes, Dr. Kapila is, although Jogavahi, very nice, for the aspect of Jogavahi, and also madhu has kasai rasa and pitta is involved. So kasai is the best rasa and fast rasa. Documented by Ashtanga Hridaya. Kasaya tikta madhura pitta manyate kurbate. Kurbate. So madhu can be taken in the regular diet. Same has been advised to the patients by me. Next. After treatment, after 40 days of treatment, you read. I will not read. You read. Patient 1, total bilirubin was 9.8. It is now 2.0. Okay. Then direct was 8.0. It is 0.9, normal. Indirect was 1.8, 1.1, normal. SGOT was 1027. It is 196. SGPT was 652. It is 75. So this patient, the first patient number 1, was diagnosed by the modern doctor was acute hepatitis, Ayurvedic drug induced. So can you imagine? If it was Ayurvedic drug induced, how was the liver function test become normal by giving that Ayurveda medicines? Put your views in chat box. If the doctor told that if the liver function was, SGOT was 1027, SGPT was 652, and within 45 days it was, SGPT was 196 and 75. If the toxicity elevation was due to Ayurveda medicine, how it was subsided by taking Ayurveda medicine? It will be, I'm waiting to show the total case study to the doctor when the SGOT, SGPT level will be 100% normal. It's almost normal when it will reach 40. Then second patient 2, total bilirubin 5.9, it is 1.23. Direct 2.9, it is 0.67. Indirect, just subscribe, you'll get. SGOT 37, normal. SGPT 44, almost normal. Patient number 3, 2.6, 0.93. Direct bilirubin 1.4, it is 0.63. Indirect bilirubin, you see, you'll just subscribe, it is 0.30. SGOT was 16.6. Okay, it is 129 SGOT, it is 49. SGPT 75, it is 61. Near about normal. Patient number 4, it has not completed. He has not completed 40 days. He is about to complete 40 days. He is right now on, I think it has been written 22 days, I think. So his also level has been subsided. And the very interesting thing is that पूरे वादे के साथ बोलना आयुर्वेद का कैसा है क्वालिटी. Patient symptoms subsided within 7 days, and these patients video will be shared by Dr. Prithis also. They have given their precious video. 7 days in all 4 patients. So now you tell me, everybody was putting question in the chat box, sir. No, it is not due to Ayurveda medicines, but you have to prove in this way that this is not due to Ayurveda medicines. You have to prove, you have to show that this is. So you tell me right now, what was about investigation? Viral marker negative, everything negative, ultrasound negative, everything all negative. Then he told it is due to Ayurveda medicines. But I diagnosed a Jakrut Brudhi from Udar Roga Chikitsa, implemented the Raktavasudota Chikitsa. I treated, see the report. Next slide. Thank you. Anyone anyone questions me? Dr. Sumnath Mishra, yes. What is the difference between Potla Patunayat Kasa and Kasa?
Sir,
What is the
we will discuss all the questions in Q&A
Potla
session.
Patunayat
First
Kasa
of
is
all,
Kasa
I would
tablet? Yes,
like
sir.
to
Yes.
share the videos and all you provided
Please,
to us.
please
So we
share the
will
video.
share the videos. After
Yes,
that,
yes.
we will discuss all the question and
Yes,
answers.
yes, 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 yes.
My name is Anjali. I'm second prof BMS student at Shri College of Ayurvedic Science and Research Hospital, Cuttack. Recently, I was facing problems of stomach pain, fever, and vomiting. I wasn't able to digest anything, so I went to our Ayurvedic hospital. They suggested some tests. After doing the test, I was diagnosed with viral hepatitis and jaundice. My liver enzymes increased. So I was under the treatment of Ayurvedic medicines for 1 month, and after continuing the diet as prescribed by the doctors and taking medicines for 1 month, now I am feeling fine, better than before, and my liver enzymes has decreased, and I am symptomatically fit.
नमस्ते, मेरा नाम अनुराग बेरा है। श्री कॉलेज ऑफ आयुर्वेदिक साइंस एंड रिसर्च हॉस्पिटल में मैं सेकेंड ईयर में पढ़ता हूँ। पिछले कुछ दिनों में मेरे को तबीयत ठीक नहीं लग रहा था और काफ़ी ज़्यादा वीकनेस था। मैंने अपने आयुर्वेदिक हॉस्पिटल में आके अपना ट्रीटमेंट शुरू किया, तो वहाँ पे मेरे को कुछ टेस्ट लिखवाया गया। वो टेस्ट करने के बाद मेरे को एक्यूट हेपेटाइटिस से डायग्नोज किया गया था, और मैंने अपना आयुर्वेदिक मेडिसिन से अपना ट्रीटमेंट शुरू करने के बाद लीवर एंजाइम सब नॉर्मल्स पे आ गए हैं, और अभी मैं पहले से बेहतर महसूस कर रहा हूँ।
Shall we move to question answer round?
I'm Srinivas Ramanujadasan, student of first year BAMS, श्री यूनिवर्सिटी। मुझे सीवियर जॉन्डिस हुआ था और 5 दिन तक मैं कुछ भी खा नहीं पा रहा था और पानी तक मैं पचा नहीं पा रहा था। पानी पीते ही मुझे उल्टी हो जा रही थी, और उल्टी होने के कारण मुझे इतना डिहाइड्रेशन हो गया। 5 दिन तक मैं बिल्कुल पानी नहीं पी पाया, लेकिन आयुर्वेदिक ट्रीटमेंट सेव मी। डॉक्टर संजीव कुमार दास ने मेरा ट्रीटमेंट किया, और लिटरली फर्स्ट डोज लेते ही मैंने दोपहर में 12 बजे के आसपास फर्स्ट डोज लिया, और फर्स्ट डोज लेते ही शाम को 4 बजे तक मेरी ये हालत थी। मतलब मैं 5 दिन से कुछ खाया पिया नहीं था, लेकिन शाम को 4 बजने तक मेरी ये हालत हो चुकी थी कि मैं आई लिटरली ट्राइड एंड मैं जंप करके दिखाया मेरे फैमिली मेंबर्स को कि सी दिस इज द पावर ऑफ आयुर्वेदा। सो आई वॉज एबल टू ड्रिंक वाटर। मैंने लिटरली 5 दिन से कुछ नहीं पिया था। उसके बाद मैं इमीडिएटली 1 लीटर नींबू पानी पी गया। इतना फास्ट मेरा अग्नि रिकवर किया, मेरा भूख अच्छे से बढ़ने लग गया, और मैं 1-2 दिन में नॉर्मल लाइट डाइट पे था, और जैसे लिक्विड पे, और उसके बाद थर्ड डे से मैं सॉलिड फूड खाना भी शुरू कर दिया। मेरा भूख भी वापस आ गया, और 1 हफ्ते के अंदर मेरा जॉन्डिस ऑलमोस्ट मतलब बॉडी में तो कुछ भी प्रॉब्लम बचा नहीं था, पूरा क्योर हो गया।
So after the patient reviews, we will move on to the Q&A session. Sir, actually, many people are anxious to know that actually what was the cause of that acute hepatitis in that patient. Many people are asking that question. According to you, what may be the cause if drug-induced intoxication is not the particular cause?
The exact cause, as I described from Charak Samhita, Ruksha, Amla, Vidahi, Katu, and Viruddha Annapanani.
So that taking outside food, chow mein and biryani, I think maybe due to that acute hepatitis developed in that
Exactly.
patient. And Guruchi and Manjista, obviously, those are two best drugs of Ayurveda,
Yes,
and
yes.
they will never induce that disease in the person.
Yes.
So, moving on to next question, our Dr. Somnath Mishra.
Uh, Dr. Somnath Mishra is asked, am I audible? Am I audible?
Yes, sir, you're audible. So once
So,
again,
Dr.
may
Somnath
I
Mishra's
repeat the
question
question?
was, Dr. Somnath Mishra's question was, why Potla Katunade Kasai why not tablet? Because, sir, I used to prescribe Kasai in the sense, why? Because liquid form is more easily and more within less time it will be digestible and it will. I have tried on both the things, kasaya and also in tablet form. But kasaya is more effective than that of the tablet. Why? Because it is in liquid form and it will be, because you know that Ayurveda medicine works after digestion. Anybody whose agni power is more, so medicine will be digested more easily. So that's why in comparison to the tablet, it will be more digestible in a very less time. It will be digested. So that's why we just put or we give potra katunadi kasaya without giving tablet. I never prescribe tablet to anyone because kasaya is that patient told na Ramakrishna. He told that when he took the potra katunadi kasaya in the morning and up to evening Agni enhanced. Because Tikta Rasa, I'm a Pachak. Agni enhancing property is more in liquid form than that of the tablet form. Next is
The question,
next
sir,
is
from Dr. Saujanya. She's asking that line of approach in non-alcoholic liver disease. What is the line of approach in treatment of non-alcoholic liver disease?
non-alcoholic liver disease. Which can you tell me some presentation of the patient, because I have already had a paper on it applied on 2 to 3 patients. Okay, anyway, I am not going deeper into it. If non-alcoholic liver patient is coming to you, you just adopt Virechan therapy for the patient. You just give Dipan Pachan, then Ghrutapana, then Abhyanga Swadhana, then do Virechan. After the completion of Virechana, liver enzymes will be normal. Within, I think within 10 to 15 days, liver enzymes will be normal. In this particular case, I have also thought to give the classical Virechan therapy. I couldn't give because Agnivach Manda, pain and all the complaints were so aggressive. So that's why Dipan Pachana will be time consuming. So that's why for instant relief, I started medicine. But for alcoholic liver disease, you just start Virechan therapy. Don't try any medication on it. I have a paper recently going to be published in good journal on it. Don't worry. Just go for Virechan therapy. Dipan Pachan I am saying. Dipan Pachan with Potral Katunyadi Kasaya or Agnitundi Bhatti. Then Ghrutapan with Indukata Ghruta. Then followed by Abhyanga and Swadhana. Then for the Virechana, you just give Tribrutleha followed by Triphala Kotha. Do it. After 10 to 15 days, liver enzymes will be normal. And symptomatically, patient will be very nice in alcoholic liver cirrhosis and also in alcoholic liver disease, and also in case of alcoholic liver disease. Because recently I put Virejan therapy to a patient who has daily 650 ml of alcohol for the last 16 years. And his fibrosis is grade 4 fibrosis. I did Virejan therapy. All the liver enzymes are normal and also symptomatically became good. So Virejan therapy is very good in this context. Go for it. Next.
Sir, next question from Dr. Kapila. If the patient is alcoholic, then what is the line of treatment?
If the patient is alcoholic,
Alcohol.
I've already told na. If the patient is alcoholic, don't try any medication. Just give Virejan therapy to the patient. Don't try any medication. Just take the 15 days of the patient, then do Dipan Pajan, Snehapan, Triratri, Avasara Kala, then Virejan. Don't try any medicine. Just give Virejan therapy. Within 15 to 10 to 15 days, it will be normal. Alcoholic liver disease.
Virejan is the ideal line of treatment for
100. Yes, yes, yes.
any liver disease. We can start Virejan.
Yes, yes, yes.
Next question from Dr. Gurpreet Singh. What is the approach to patient with Tamaha Pravesh, hepatic encephalopathy if it is present, and what can be done with Ayurveda?
I don't know, sir, because in case of hepatoencephalopathy, I have not been consulted any type of hepatoencephalopathy patient till date. One patient shared her documents to me with Wilson's disease, that is hepatolenticular degeneration. You may be knowing copper deficiency is more. So that patient is admitted in some hospital in Odisha, and she has sent some documents to me, and that patient probably will come within 7 days. So that will be my first patient for treatment. So till date, I have not dealt any type of hepatic encephalopathy patient.
Sir, we will be looking forward for your results also in that question, and I know you will share with all of us. So
Definitely.
next one question is there. If with Yakrik with his splenomegaly is there, if spleen with is also there, Pliha Vidhi, then these medicines will be effective in them, it or not?
Sorry.
Yes. If with Yakrit Vidhi, Pliha Vidhi is also present, splenomegaly is also
Yeah.
present, then can we give this?
Yes. Which medicine? Okay. So
Those medicines you tried, no, Prabodhini and Patol Katuru Vinyati. So can we give in Pliha Vidhi also, or any extra medicine we have to add?
actually, from my experience point of view, in hepatomegaly or Jakrut Buddhi, I have given medicines and it has been subsided. But in case of splenomegaly, till date I have not got any patient of splenomegaly. But from book point of view, if I can suggest to give Pipali Rasayana, because it has been mentioned in Charak Sanhita, Plihodaram. Pipali Rasayanam, Bardhaman Pipali Rasayanam can be given, and also the very good drug will be Rohitaka Risto. But thing is that I have applied on liver disease, Jakrut Bruti, but I have never applied on Pliha Bruti. So whenever I will be experiencing, definitely in next talk I will be sharing the same.
Yes, sure, sir. So next question from Praveen Kumar. What is the main complication of hepatitis and how to treat those complications?
What is the main complication of hepatitis? How to treat, sir? So I have already told that hepatitis is of 5 variety: A, B, C, D, and E. So as you know, A as modern is concerned. So that's why I am saying in modern language. In case of A, in case of E, okay, in case of A and E, those which are transmitted through the contaminated water and contaminated diet, these can be given or these can be treated successfully by the Ayurveda medicines. But the hepatitis like B and also other hepatitis which are transmitted by the blood to blood contact and also other contact medias, they cannot be treated by Ayurveda medicines. From the experience point of view, I am saying, but I have not dealt any kind of hepatitis B positive patients personally I have not treated. So modern people are giving some medicines to it, temper clear like drugs. So in case of hepatitis B positive patients, I will be silent because I have not treated any case of hepatitis B. I have not treated.
Okay, maybe antiviral treatment should be continued in those patients.
Yes,
Then we
B50
can
to
then we can add Ayurvedic medicines with that also, with antiviral treatment.
because I am in such an organization right now. Whenever any patient is coming to me, it is very risky for me to treat. Why? Because whatever I am giving medicines, I have to justify and I have to prove it scientifically. So that's why if any complicated patient is coming, so I am giving a light that you just go to that doctor, you just go to that doctor. I have no experience on it. And if a patient is giving consent that sir, I am ready to take your treatment, so I just jump over that. मैं नहीं छोड़ता उसको, शुरू कर देता हूँ ट्रीटमेंट तुरंत. तो ये टाइप का हेपेटाइटिस बी टाइप का पेशेंट आज तक मैंने ट्रीटमेंट किसी को नहीं किया हुआ है कि मेरे पास डॉक्यूमेंट ही नहीं है.
Actually, being Ayurvedic physicians, we need the chance to prove ourselves. Actually, that's why. So next question.
Definitely, if the blessings of my teachers, Almighty God and Charak's mercy is there on me, definitely a day will come like hepatitis. Others, what I discussed, what I discussed today. Like definitely, I will one day will come. I will also prove the. I may not prove that hepatitis B will be cured, but I may prove that titer of the virus or viral load will be less by taking the Ayurveda medicines. Definitely, definitely.
One question from Dr. Jayashree India. In some patients of hepatitis, alkaline phosphatase increase, although SGOT and SGPT values are normal. So, which medicines we can prescribe in those cases when only alkaline phosphatase is high?
No. In this slide, I have already discussed. You see, in this slide, I have already discussed that alkaline phosphatase in relation to SGOT, SGPT, you have to see. Nothing happened like this. That alkaline phosphatase is not increased, SGOT, SGPT level values normal. No. In fast assault, SGOT, SGPT first increases. Then alkaline phosphatase increases. But increase of both the things are simultaneous. You cannot say like this. But as a whole, what I told, पोटळ कटून येते कसं आहे आरोग्यवर्धिनी बोलतो.
Okay, so one more question from Amit Saxen.
SGPT is 55. What is the treatment? You just give पोटळ कटून येते कसं आहे, my dear friend, within 15 days it will be normal. Don't worry. In severe alcoholics, I have given. In severe alcoholics, I have given. Potal cotton is the and argue body. Severe alcoholics mean you may be assuming like every day 650 or what is the amount of the pint, I don't know. Every day they are used to taking. So, but the important thing is you need to stop alcohol taking during the time of medicine intake. Otherwise, you will be taking medicine, you will be taking alcohol and taking all the bad diets. No, completely patient will be under good exercise. Patient will be under good diet. Patient will be on complete abstinence from the alcohol intake. Then our medicine within 15 days, there will be good result. SGPT 50 days, after SGPT is 55, it's a very, it's a very simple thing. You just start portal reduced within 15 days. It will come to normal. If hepatitis B positive status of patient, if hepatitis B positive,
B that already we discussed, if viral load is there, then you have to use antivirals, and along with that, you can use the Ayurvedic
Tenflo they are giving. They are giving one medicine, Tenflo clear. Allopathic doctors are giving, and they are in every 1 month or 2 months they are assessing the viral load in case of the patient, because virus will no way not at all go away from the body. So they are observing the titer. Why titer? They are observing and giving the medicines because HIV, HBS positive or HIV B positive patients are more vulnerable to develop SCC, hepatocellular carcinoma. So that's why when viral load will be less, so there will be less vulnerability for the patient to be affected by next liver cancer. So that's they were giving antiviral drugs. But if I am getting a chance to treat, so definitely I will, in addition to their medicines, definitely I will prescribe my medicines or any sort of Birachana medicines or like that. So patients counseling is very necessary, and patients motivations towards our medicines is very necessary. I'll get, I know.
One more question is there, sir. What is your view on using Tapyadi law for liver disease?
Tapyadi Loho, I have never given to any patients, but it can be tried, no problem. My observation is on Parva-5 and Potala Kosa. Tapyadi Loho, I have never prescribed to any patients. But as per classics or as per hypothesis, as per documentation, you can give plastic Tapyadi Loho.
Sir, one more question is there. In Charak Samhita Siddhi Sthan, Panchakarma Siddhi Adhyaya, that Acharya Charak told not to use Virechan and Madatya at this. So, can you please explain a little more about that administration of Virechan?
It is a very nice question also. Dr. Priti is a very nice question. But we need to understand what is Madatya and what is Madhya Sevanajanya Vikara. Madatya is something different. Madhya Sevanajanya Vikara is something different. So that's why it is true. Madatya cannot be given, therapy. It's true. It has been written in the Charak Samhita. And Mother Sevanajanya Vikar, this is something different.
So both the cases are different. That should be
100%
noted
different.
very carefully. That do not compare Madavastha with Madatya Avastha.
Exactly.
Both are different. Right?
I have also thought on it during writing my article. I thought on it. Shall I put Madatya word? Then I read. Oh, Madatya is something different from the Madhya Sevanajanya Vikara. Complete different.
One more question is there, sir. Are there any drugs in Ayurveda which should be avoided during acute hepatitis?
Yes, it is a nice question. Actually, in last seminar, we had the same discussion also. Some toxic drugs, what have been documented in Ayurveda classics, and some non-toxic drugs in excessive quantity. It was a question to one of the professors to me that what is the safety duration of prescriptions of Langoli and Ashwagandha, Guduchi, and Sarpagandha to any person. So I think being a Kajikisa person, whatever medicines till date I have prescribed to any patients of liver, of kidney, Rasaushadhi, herbal medicines, whatever I have prescribed, because to some patients I have prescribed 6 months to 1 year of Rasaushadhi, and every 15 to 30 days I assess liver function test and kidney function test, but I have never got any type of enzymatic issues in those cases. So that is basically dependent upon the doctor, what medicine he is prescribing and how he is assessing the patient. So his question is concerned, as a Kajikisa person, what medicines till date I have given to the patients for 3 months, 6 months and 1 year. I have never observed any elevations in liver enzymes or kidney profile. So medicines, what Basant Kusmakar Rasa, Bruhat Bat Gajankus, Bruhat Bat Chintamani, Rasaraj Rasa, Jugraj Gugula, Amrutadi Gugula, Topchin Rasayana, Guduchadi Gugula, Khadira Rishta, Arugavardhini Boti, Agnitundi Boti, Bishatinduka Boti, then your then come to your internal or herbal medicine, Saraswata Rishta, Brahmi Gruta, Indukanta Gruta, Panchatikta Gruta, medicines, herbal and hormonal and also mineral medicine I have tried. I have tried Bruhat Bangeshwar. Bruhat Bangeshwar I have tried more than 1 year. Bruhat Bangeshwar I have tried. Bruhat Basant Kusmakar I have tried more than 1 year. Haritala I have tried more than 1 month. So basically, I would avoid Haritala to the ladies patient because Sri Puspa Hara it has been written in the book. So that's why I fear to give basically to the pregnant and ladies patients. So we have to follow sometimes the ethics, na? So it depends upon you. If you are asking about my experience, I normally prescribe Rasaushadhi from Dabur company and Ghruta items from Kotakal or Vaidyaratnam, okay, and some herbal medicines from local companies like Vaishnavi Churna, making Sitapaladi Churna, Abhipatikara Churna, Triphala Churna, this kind of drugs. So don't worry. Regarding Sarpagandha Boti, you'll be astonished to know. Sarpagandha Boti, Dabur is making 125 milligram. Okay. And your Bajanath is making 375 milligram. 375 milligram I give to one tablet twice a day for to a person. At least 30 days, 60 days I have given. After the liver function test, nothing, no problem.
Sir, so basically, if the medicine is prepared in a proper way, then we can give any medicine. It won't
Yes.
hamper the liver functions at least.
That's why I have told the name of the company. Dabur, Vaidyanath, then Vaidyaratnam. Then one medicine I am prescribing right now, it is in the Visavarga of, you may be knowing Langoli. Langoli is a very good drug for Vata Rakta and also many pain in the body. So Flexofen MR of Revento company is coming. So Langoli I am prescribing months together. I prescribed 1 month, 1.5 month, 2 month. Nothing has happened to liver. Nothing has happened to liver. Nothing has happened to kidney.
So
I have documentation. Why I am saying I have documentation everything. And Guduchi, 6 months I have prescribed to patients. One chronic ileitis patient was there, and he was referred from Apollo Hospital. And Apollo Hospital doctors were giving him Exemptia, an injection for chronic ileitis costing 20,000. They have given 18 units of Exemptia. As he is a higher rank officer from India ref. I have given treatment for 6 months. If any chance will come, I will present a paper on it in your webinar. Management of chronic ileitis with Ayurveda treatment. And in that case, I have given Amrut more than 3 to 4 months. Nothing has happened. Now he is fine. She is fine.
So basically, we can conclude that no Ayurvedic medicine is toxic to any part of our body if it is
No.
prepared properly.
Proper.
Right.
Yes.
Yes, sir. Next question we have: does any error in dinacharya leads to liver disorders? Dinacharya.
I have already told na. In the dinacharya means I have not told of the dinacharya because to these patients I have not added any dinacharya. Why? Because they were panic in nature at that time because pain was there, vomiting was there. So that's why I told to take a rest actually. But dinacharya.
Because normally we read in many places that Ratri Jagrana, if one is doing Jagrana in night, then that affects the liver.
Yes. Dinacharya in the sense I told that to drag the diet I have told. That in the evening you have to take. I have told that you have to complete your dinner within 6:30 to 7 or 7:30 maximum, and in the lunch time you have to take the diet. Breakfast in the particular time, and in the breakfast I have prescribed you have to take dalia, oats type of diet or mudga juice, and in the lunch time you may take chapati or santula available in Odisha, and also you may take. May normally advise साढ़े षष्ठी का दी उसना चावल उसका उसना चावल का जो पेज निकल दिया जाता है वो पेज निकलने के लिए मैं मना करता हूँ पेज रहित मतलब उदन जो बोलते हैं ना भात को जो सीजा जाता है उसमें जो पानी के साथ जो चावल है उसी को पेशेंट लेगा और मैं ये एडवाइस किया हूँ कभी अरहर का दाल मत लेना बिना मुद्ग डाल के जिंदगी में कुछ भी डाल नहीं छूना है हमको केवल मुद्ग डाल मुद्ग जूसो सैंधव आमलकी और जब होगा तो ठीक है और ये पेशेंट सारे यही चीज ही लिए हैं रोटी वोटी भी बीच बीच में ले लेके नहीं मिलता है आजकल लेकिन ज्यादा में उनको वही उसी में रखा था मैं पेयादिक्रम में रखा था मैं कि चावल लाओ उसना चावल लाओ पानी उसको उबालो पानी के साथ पानी जो भात होता है उसमें थोड़ा नमक वमक डाल के मुद्ग जूस के साथ उसको खाओ ये डाइट था मेरा सर
चावल उबालने के बाद आपको पानी ड्रेन नहीं करना है उसका
नहीं करना है पानी ड्रेन नहीं करना यस
सेंधा नमक डाल के लेना है
यस करके देखो हमारा पेशेंट जब आईपीडी में आते हैं तो वो बोलते हैं क्या सर डॉक्टर साहब ये बेकार खाना देते हो मैं बोला अगर आप अच्छा खाना होते तो वो 5 स्टार होटल में होते ये क्यों आए हो आप इधर आए हो मतलब वही वाला खाना पड़ेगा सीझा संतुला वही वाला ये हमारा डाइट ही है
Actually, pathya should be maintained because it is said that without pathya, nothing is effective.
Yes.
Pathya should be.
Yes. क्योंकि पथ्य सत्य गदार्थ से कीमत औषध निषेवणी पथ्य सत्य गदार्थ से कीमत औषध निषेवणी तो लिख दिए हैं और हमको क्या बोलना है
So, sir, one problem is with our students. Deya is healthy, he is writing. So one problem is with our students, because all the students usually tend to read at night only. So they are doing Ratri Jagaran, and most of the students have constipation and loss of appetite as complaints. So does that really hamper the liver function, Ratri Jagaran?
Sarak and Susud has clearly mentioned that if anybody is sleeping late in the night, he should get up in the morning in the late time. That can be practiced only. Otherwise we can follow the Padangsika Krama of Charak Samhita. वो को साथ में अगर बनाना है, जैसे कि रात्रि में दधी खाना मना है, लेकिन जिसी का औकसात में हो वो रात्रि में दही चाहिए, तो इसको औकसात में बनाना है हमको। मतलब 7 सप्ताह में हर 7 डेज में रात 3 बजे से ये करेंगे और सुबह 6 बजे उठेंगे, शरीर कभी नहीं ठीक रहेगा और मैं भी कुछ नहीं कर पाऊंगा। चरक ने ऑलरेडी लिखे हैं, अगर रात भर जगते हो तो सुबह उठो, सुबह जल्दी मत उठो, सुबह थोड़ा लेट में उठो। इसलिए अष्टांग हृदय ने एक श्लोक में लिखे हैं, ब्राह्म मुहूर्ते उत्तिष्ठेतात् जीर्णा जीर्ण निरूपयम। आपके आहार जीर्ण हुआ है या अजीर्ण हुआ है उसको निरूपण करके लेट में उठो, तो 9 बजे 10 बजे उठो, ये सोल्यूशन है और दवाई से काम नहीं होगा।
फिर many students are facing this problem ना, रात में वो लोग पढ़ते हैं बहुत लेट नाइट तक, फिर सुबह उठ के ट्यूशंस जाना है, ऑनलाइन क्लासेस अटेंड करना है, फिर कॉलेज जाना है, एकदम हेक्टिक लाइफ होती है उनकी। तो ज्यादातर ये कंप्लेंट्स देखने को मिली है स्टूडेंट्स।
हाँ, एक चीज किया जा सकता है, जैसे कि योग निद्रा एक है। योग निद्रा क्या होता है, वो इफेक्टिव निद्रा होता है लेकिन कम टाइम में भी फुल निद्रा हो जाता है। और योग निद्रा का प्रैक्टिस करना पड़ेगा, जो कि हमारे मोदी जी करते हैं। वो 2-3 घंटा सोते हैं लेकिन पूरी नींद उनको पूरा सफिशिएंट हो जाता है। कैसे? क्योंकि योग निद्रा करते हैं। तो योग निद्रा से हो सकता है 3 बजे सोए और फिर जो 2-3 घंटा मिला मूवी देख लिए, ऐसे नहीं होगा। योग निद्रा प्रैक्टिस करना पड़ेगा। हमारे यहाँ आर्ट ऑफ लिविंग में एक हैप्पीनेस कोर्स किया जा सकता है। हमारे यहाँ आर्ट ऑफ लिविंग में हैप्पीनेस कोर्स किया जाता है, जिसमें सुदर्शन क्रिया बोलते हैं। ये सुदर्शन क्रिया में भी बहुत सारा चीज सिखा जाता है, जिसमें अपना पूरा आ जाएगा, आपका जो कंट्रोलिंग पावर आ जाएगा निद्रा के ऊपर। योग निद्रा हो सकता है उसमें।
One of our participants had shared one document, Deepen Devpur. He has shared one document, a case report on acute hepatitis involving the medicinal herb Dinospora cordifolia along with other variables. So, acute hepatitis, I think it is the use of Dinospora cordifolia, Guruji. So, that herbal medicine intoxication has touched everyone's heart. Why he was telling like that? Guruji and Manjushta is a toxic effect that acute hepatitis develops.
My friend, I have already said a lot of time in this discussion that one doctor has told that this is Ayurvedic toxin, Ayurvedic drug related toxicity. So how the liver enzymes are reduced by the Ayurvedic medicine? If patient diagnosed with Ayurvedic drug induced hepatitis and that patient was cured by taking the Ayurvedic medicine, so how can it be possible? This article is a vague. And for your information, I am saying you one thing. Recently, JAMA published, JAMA you may be knowing. JAMA is the highest prestigious journal of the allopathic doctors. That levocetirizine is causing cerebral atrophy. It means we have created cerebral atrophy since last 50 years of many patients. So you have toxicity, we have also toxicity. But right now we proved that it cannot be toxic because Ayurvedic drug-induced hepatitis was treated by same Ayurveda medicines and liver enzymes were depressed. So I think by this experimentation, there will be no confusion in your mind and very straightforward you can say to any doctor that this Giloy and so publication is wrong, 100% wrong. Just forget it.
Right, sir. Thank you so much, sir, with this question. I think our question and answer session is over now, and no more questions are here for today's session. So, coming to the last well-lectured session, I really thank all the our patron and co-patron, our Dr. Shalindra Yadav sir, Dr. Sunita Yadav ma'am, and our principal sir, Srinivas sir, for giving us a chance, a platform like this to discuss so many things which we actually is the need of our to prove our Ayurveda in the society. And overall, I would like to thank all the participants, all the practitioners are there, teachers are there, students are there. Many students, UGPT students are there who have participated in today's session, and always they are with us in the Prabodhini webinar series also. So I would like to thank all of them. And lastly, I would like to thank our guest speaker, Dr. Sanjib Kumar Das, for this fantastic scientific session, sharing his valuable experiences. And in future also, we will be expecting for more sessions from you, sir. And many feedbacks are coming, very nice experience, sir, very nice session. They all are writing, they all are happy today. So thank you so much, and thank you to all the organizers and all the technical team who have supported in this webinar. So with this note, I will end this session, and everyone will get the e-certificates on their mail. So no need to get panic. Within 7 working days, we will be getting your certificate. And those who have 45 minutes attendance, they will get. Those who are coming and going, we are not providing certificates to them. So the participants with minimum 45 minutes attendance will get the certificates. So with this note, I will end this session here. Thank you so much. Thank you, Sanjeev sir. Thank you so much to everyone.
Thank you, Dr. Preeti. Thank you, Dr. Nihar. Thank you, Principal Sir, Director, and all the stakeholders, other directly or indirectly involved. And also, thanks to all the participants who have had a good patience to listen my boring things. And I will expect from your group to, although you will not invite me as a guest speaker, chief speaker, or something like this, but to validate some knowledge from my experience.
Yes, sir.
Whenever
Surely
you
we
will,
will invite you, sir. It is a very good experience today, and in future also we will be looking forward for your scientific session, sir. We will surely invite you.
thank you. Thank
So
you.
we will end this session with our national anthem. Please be ready for it.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता। पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा। विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा। तव शुभ नामे जागे तव शुभ आशीष मांगे। गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे जय 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 हे।
So much for everyone.
Thank you, Preeti. Thank you. Okay.
Thank you so much, sir, for your support.
Thank you.